Vaginal discharge is a perfectly normal part of being a woman. It's your body's way of cleaning and protecting the vagina. Just like your nose produces mucus, your vagina produces discharge. This discharge helps to keep the vagina healthy by removing old cells and bacteria. It's important to remember that every woman's body is different. What's normal for one woman might be different for another. Don't be embarrassed to talk about vaginal discharge. It's a natural process that all women experience. Understanding your discharge is key to understanding your vaginal health. Vaginal discharge can vary in color, consistency, and amount. These variations are often linked to your menstrual cycle. For example, you might notice more discharge around the time of ovulation. Clear and stretchy discharge is a sign of ovulation. This type of discharge helps sperm travel to the egg. White or milky discharge is also common. This type of discharge is usually normal, especially if it occurs at the beginning or end of your cycle. However, changes in color, consistency, or smell can sometimes indicate an infection. It's important to be aware of these changes and to see a doctor if you have any concerns. White discharge is considered normal if it has a mild odor or no odor at all. This type of discharge is a natural way for the body to maintain a healthy balance of bacteria and to keep the vaginal area clean. It acts as a self-cleaning mechanism, helping to remove dead cells and other debris from the vaginal lining. It should also have a thin, milky consistency. This consistency can vary slightly depending on where you are in your menstrual cycle. For instance, during ovulation, the discharge may become more slippery and stretchy, resembling egg whites, which is perfectly normal and indicates fertility. You might notice an increase in white discharge before and after your period. This is due to hormonal changes that occur throughout the menstrual cycle. Estrogen levels rise and fall, influencing the amount and texture of the discharge. Keeping track of these changes can help you understand your body's natural rhythm and identify any abnormalities. However, if the white discharge is thick, clumpy, or has a strong odor, it could be a sign of a yeast infection. Yeast infections are caused by an overgrowth of candida, a type of fungus that naturally lives in the vagina. Symptoms may also include itching, burning, and irritation. Yeast infections are common and easily treatable. Over-the-counter antifungal medications are often effective, but it's important to follow the treatment instructions carefully. In some cases, a prescription medication may be necessary. Always consult with a healthcare professional to ensure you're using the right treatment for your specific condition. It's important to note that not all white discharge is a cause for concern. Variations in discharge can be influenced by factors such as diet, stress, and sexual activity. Understanding what is normal for your body can help you distinguish between harmless changes and potential issues. If you're unsure, it's always best to err on the side of caution and consult with your doctor. They can provide personalized advice based on your medical history and current symptoms. Telehealth consultations have made it easier than ever to seek professional guidance without leaving your home. They can help determine the cause of your symptoms and recommend the appropriate treatment. Whether it's a simple lifestyle adjustment or a specific medication, getting the right advice can make a significant difference in your comfort and health. Remember, your well-being is worth the time and effort to seek professional help when needed. While some variation in discharge is normal, certain changes can signal a problem. If your discharge changes color, consistency, or smell, it's important to pay attention. For instance, yellow or green discharge, especially if it has a foul odor, could be a sign of a bacterial infection. Similarly, gray discharge with a fishy smell can indicate bacterial vaginosis. Changes in consistency can also be telling. Thick, white, cottage cheese-like discharge is often associated with yeast infections, while frothy or bubbly discharge might suggest trichomoniasis. Any significant change in your discharge should warrant a visit to your healthcare provider. If you notice any unusual changes in your vaginal discharge, such as a different color, consistency, or an unusual odor, it's important to pay attention to these signs. These changes can sometimes be an indication of an underlying issue that needs medical attention. Don't hesitate to schedule an appointment with your doctor. Early detection and treatment can prevent potential complications. When you call your healthcare provider, be sure to describe your symptoms in detail so they can prioritize your appointment accordingly. They can help determine the cause of your symptoms and recommend the appropriate treatment. Your doctor will take a thorough medical history and may ask you questions about your lifestyle, recent activities, and any other symptoms you might be experiencing. This information is crucial for an accurate diagnosis. It's important to remember that self-treating can sometimes worsen the situation. Over-the-counter medications might seem like a quick fix, but they can mask the symptoms without addressing the root cause. In some cases, they can even lead to resistance or more severe infections. What works for one condition might not be suitable for another. For example, treatments for bacterial infections are different from those for fungal infections. Using the wrong medication can delay proper treatment and recovery. Your doctor can perform a pelvic exam and take a sample of your discharge for testing. This might seem uncomfortable, but it's a quick and essential step in diagnosing the issue. The sample will be sent to a lab where it will be analyzed for any signs of infection or other abnormalities. This will help them identify the root cause of the problem and provide you with the most effective treatment plan. Once the results are in, your doctor will discuss them with you and explain the next steps. They might prescribe medication, suggest lifestyle changes, or recommend further tests if needed. Remember, seeking medical advice promptly is crucial for maintaining your vaginal health and overall well-being. Regular checkups and being attentive to your body's signals can help you stay healthy and prevent minor issues from becoming major health concerns. Don't wait until symptoms become severe. Take action early and stay informed about your health. Maintaining good vaginal hygiene is crucial for preventing infections and discomfort. It is an essential part of overall health and well-being. A clean and healthy vaginal environment can help you feel more confident and comfortable in your daily life. This includes washing your genital area daily with mild, unscented soap and water. Using harsh soaps or scented products can irritate the sensitive skin in this area and disrupt the natural pH balance. It's important to be gentle and thorough, ensuring that you rinse well to remove all soap residue. Avoid douching, as it can disrupt the natural balance of bacteria in your vagina. Douching can remove the good bacteria that help keep your vagina healthy, leading to an increased risk of infections. Instead, focus on maintaining a regular hygiene routine and consult with your healthcare provider if you have concerns about vaginal odor or discharge. Wearing breathable cotton underwear and loose-fitting clothing can also help prevent moisture buildup, which can create a breeding ground for bacteria and yeast. Cotton allows air to circulate, keeping the area dry and reducing the risk of infections. Avoid tight-fitting clothes and synthetic fabrics that can trap moisture and heat. Remember to wipe from front to back after using the toilet to prevent the spread of bacteria from the anus to the vagina. This simple habit can significantly reduce the risk of urinary tract infections and other bacterial infections. Always use clean, soft toilet paper and avoid excessive wiping, which can cause irritation. Practicing safe sex by using condoms can also help protect you from sexually transmitted infections, which can also cause changes in vaginal discharge. Condoms act as a barrier, preventing the exchange of bodily fluids and reducing the risk of infection. It's important to use condoms correctly and consistently, and to communicate with your partner about sexual health and safety. Regular checkups with your healthcare provider can also help you stay informed and proactive about your vaginal health. Understanding your body and its natural processes is essential for your overall well-being. By familiarizing yourself with what's normal for your vaginal discharge, you can better identify any potential issues and seek timely medical attention. Remember, every woman's body is different, and what's normal for one woman may not be the same for another. Don't be afraid to ask your doctor any questions you may have about your vaginal health. Knowledge is power, and understanding your body can empower you to take control of your health and make informed decisions. There are many myths and misconceptions surrounding vaginal discharge. It's important to separate fact from fiction and rely on credible sources of information. One common myth is that all vaginal discharge is a sign of an infection. This is simply not true. As we discussed earlier, vaginal discharge is a natural process that helps keep the vagina clean and healthy. Another myth is that douching is necessary to keep the vagina clean. Douching can actually do more harm than good by disrupting the natural balance of bacteria in the vagina. It's important to rely on accurate information from your doctor or other healthcare professionals. By providing women with accurate and accessible information about vaginal health, we empower them to make informed decisions about their bodies. Knowledge can help dispel myths and misconceptions, reduce stigma, and encourage open communication with healthcare providers. When women feel empowered to advocate for their health, they can access timely and appropriate care, leading to better health outcomes. It's time to break the silence surrounding vaginal health and promote open, honest conversations.